welcome to today's office hours on the National Healthcare Safety Network, or NHSN. My name is Elena Baer, and I'm joined today by my colleague, Jenna Broughton. We will be talking to you a little bit about how to navigate NHSN with confidence. So, the three items that we're really going to be covering heavily in this call are going to be reviewing the required NHSN reporting. And then we're also going to be really focused in on this reporting the healthcare personnel influenza vaccinations, but we'll also talk about those COVID vaccinations as well. The influenza ones are going to be especially important because that reporting is due today. So if you haven't done it yet, we'll be walking you through exactly how to do it. But you definitely want to make sure that it gets in today. So the required reporting is where we're going to start. So there are a few different things that are required to be reported into NHSN. Some of these are weekly, and then one of them is annual. So the first one is going to be positive COVID-19 tests. So back in the day, you had to report both positive and negative tests. Now you only have to do those positive tests into NHSN. Outside of that, there are three items that kind of closely relate to vaccinations for COVID-19. Those are the weekly surveillance data. That's going to be where you're adding in that hospitalization information and those types of questions. And then you have both resident and healthcare personnel vaccinations. Now, those two are going to be asking you who's up to date. Now, one thing I do want to mention about kind of all of this NHSN data is that NHSN data reporting is now linked to your QRP. So that makes it even more important to report accurately and timely. So again, these are due on a weekly basis. Your new week starts on Mondays and it goes through Sunday. You can report any day of the week. I highly suggest picking like a Wednesday to report. And we can talk about that too and answer any questions you may have about that. But definitely making sure that you're reporting accurately, and you understand what you're reporting, and that you're reporting timely so you don't have to worry about that QRP side of things. So the other thing that is required on an annual basis, which is the one that's due today, is the HCP influenza reporting. We are going to talk a little bit more about that, both during a live tutorial, and there's another slide that describes it. So the one thing I want to talk about that has changed since we last met is, what does it mean to be up to date? Now, this is something that is so complex. I'm sure you're all familiar with how many times this has changed since the vaccines came out back at the very, very end of 2020. So most recently, back in March, the Centers for Disease Control and Prevention released new guidance on what it means to be up to date with COVID-19 vaccines. Now, the direct quote from their website says that people aged 65 years and older who received one dose of any updated 2023-2024 COVID-19 vaccine, and there are three types, Pfizer, Moderna, or Novavax, they should receive one additional dose of an updated COVID-19 vaccine at least 4 months after the previous updated dose. So that is a lot of words. What I want to make sure that you understand with this is that how I like to think of it is that when this new vaccine, this updated 2023-2024 vaccine came out back in September, everyone's slate was wiped clean. It didn't really matter if you'd gotten the primary series, if you'd gotten the bivalent vaccine, if you'd gotten multiple boosters. None of that mattered anymore. All that mattered at that point, starting in September, was that if you got this updated 2023-2024 COVID-19 vaccine, you were considered up to date. Okay, so that was the one. That was all you needed. That was the big one. Now, what happened, though, is that in March, the CDC had been watching kind of immunity changing over time since their release back in September. And what they found was that after about 4 months, the immunity from this updated 2023-2024 COVID-19 vaccine was waning. And so they were seeing that there was less immunity once we hit that 4-month mark. And so they wanted to protect our most vulnerable population. So they said people that are 65 years of age and older, if it's been 4 months since they got that vaccine initially, they should get another one. And that's when they would be considered up to date. is once they got that second one. If there is an older adult, 65 years of age and older, who never got a vaccine, never got this 2023-2024 vaccine, and they get it for the first time right now, they're still up to date. It just basically is saying that if you're in this age bracket and you haven't gotten a vaccine in the past 4 months, it's time for you to get that second one. So I want to pause here briefly and just make sure that there aren't any questions about this, because I think it's a hard thing to wrap your head around. I talk to nursing homes all the time and tell them about how I live this every day. I'm really in deep of understanding this, and it's still hard for me to verbalize how this all works. So those of you who this is a small part of your job and a small part of the things that you're focused on, because your job encompasses so many other things, it can be even more difficult to wrap your head around. So does anyone have any questions about the current definition of up to date? And you can feel free to unmute yourself or put it in the chat. All right, not hearing any, I do want to make sure that you know that you can always put things in the chat or pause, tell me to pause, and I can pause something and answer any questions you might have. This session is really for you to ask those questions and make sure that anything that you've been wondering about gets answered here today. So moving along, we understand now what that up-to-date definition means. We know that it came out in March. The CDC released this definition change back in March, but things in NHSN do not change until we hit a new quarter within NHSN. So while that change happened in March, in NHSN, you should have been continuing to report how you were reporting for that quarter without this kind of new guidance in mind, which makes it even a little more confusing. But as of April 1st, NHSN changed that up. So you might have seen a small difference in what you were reporting in NHSN starting April 1st, because NHSN did not require to use this new guidance when reporting until we hit that NHSN week starting April 1st. So since April 1st, we should have had this new definition in mind when it comes to reporting in NHSN. Now, your numbers likely would have decreased the week of April 1st, and both the CDC and CMS were expecting that decrease. So because they identified that this is a new definition, and there were plenty of people who were considered up to date because they got their vaccines back in September or October, but now it's been 4 months since then, and we just put out this new guidance, so no one even knew that there was a second dose available to them. Those numbers were probably going to go down. So they expected that. In fact, that's what they're hoping to see, so that we know that people understand this new guidance, right? So if that happened to you, that is totally normal. That is what they were expecting. There is no negative consequence coming from that because they put out some new guidance. So any questions about the COVID vaccine, please feel free to put in the chat. We'll also be looking at things directly in NHSN in just a moment. Now, annual HCP influenza reporting. This is the big one that is due today. By the end of the day today, this is due. Now, this is going to be looking at your healthcare personnel, and it's vaccinations given from October 1st, 2023 to March 31st, 2024. So this past influenza season that we just are outside of. Now, this area in NHSN is different from the typical area that you're used to putting all of this weekly data into. Instead of it being in the long-term care facility component, basically when you get to that main page and you have to select long-term care facility, this is actually going to be in the healthcare personnel safety component. So you'd have to click a little drop down, and there should be 2 there for you. But we'll walk through. If there isn't 2 there for you, I'll talk about what that means and how you can make sure to get it. I'll also post this guide shortly, and it's going to walk through basically what I'm going to walk through with you. I took a bunch of screenshots and made a guide to walk you through how to do this reporting. So with that, I am going to go into an NHSN tutorial. What I would suggest, and I'll start off slowly, is that if you, for example, have not done this HCP influenza reporting, if you want to pull up your NHSN while we are talking, you can follow right along to make sure that you get your reporting in on time today. So, give me 1 second to pull up the correct screen here. And I'm going to put the guide that I just referenced in the chat. And here we go. So let me reshare my screen. All right. So what you should be seeing now is the landing page for NHSN. So I already logged in and it brought me directly here. Now I'm going to walk through a couple different things. I'm probably going to start with the regular vaccines that you're familiar with in case you're trying to get your NHSN up so that we can walk through the influenza stuff together. But you can see here, this is where I'm talking about with the components. You either have healthcare personnel safety or you have long-term care facility. Now, long-term care facility is probably where you're most familiar. That's going to be where you put in that surveillance data. That's where you're going to put in your PCR tests. That's where you're going to put in your vaccinations. All of that stuff goes into the long-term care facility. Now, we have a Superior Health Test facility, so none of the things that you're going to see in here today are real. We don't actively put data in this all the time, so you'll see that there's a lot of missing data in here and all of that good stuff. But it's all a good learning opportunity as well so that we can show you what it looks like when you don't have data in there and then when you do report correctly. So we're going to start in the long-term care facility component. And when we enter this, you might get some pop-ups here about some reminders. This is saying I have missing data here. These are all your alerts. So if you ever have any alerts that you can't figure out yourself how to close out, it's a great opportunity to call or reach out to one of our staff members so that we can help walk you through it or let you know if it's something that we can't help you with, if it seems more of a technical issue within NHSN, how to reach out to their help desk to get assistance directly from them. So the first thing that I want to show you is going to be under this COVID-19/respiratory pathogen section. So the first thing that you'll come to is the pathway data reporting. So when we click on this, this is going to have more of a calendar view. And what we want to see in the calendar view is that because this is a weekly report, we should see some green, and if I go back a couple months, you'll see we want to see some green boxes like this in here for each week. Technically, every single week should have that green box saying that we submitted data during each week of the month. So we are going to look at this current week. So we are right here. Let's do it for today. If you click on this, there's a couple different things that pop up. The only one that you really have to be focused on here is going to be this resident impact and facility capacity. So it'll automatically populate some data depending on the way that you report or that all beds that are automatically populated. And then you have to put in your current census. So I'm going to say that our census right now is 48. And then you have to put in the number of positive tests. I'm going to say this month or this week that we have no positive tests. We've been pretty safe thus far. So sometimes when you do that, you're going to see that things automatically populate because this is going to ask you in the next section of those positive tests who are up to date. So what the CDC is looking for here is to identify those breakthrough cases. So for those residents who are up to date, how many of them had a positive test? So if I were to instead put 1 here, I could also indicate whether that one person was up to date or not. And then you will also see that that automatically changes this. So there's a lot of logic tied into this. Now, hospitalizations, kind of a similar thing. We're going to look at, with a positive test, how many of the residents are hospitalized with a positive test. So let's say that this person did get considerably ill. So we're going to say that they did get hospitalized and that they were the person that was up to date. So 111 all around. But we're going to say there were no deaths and no COVID-19 deaths. And then we can save that and you will automatically see that now we have this green bar in here. And that's what we want to see on every single week to ensure that we did not miss any weeks of reporting. So any questions on the surveillance pathway? Now, one thing I have heard in the past, and I'll continue to type in your questions or come off mute and I'll watch for you. One thing I have heard in the past and have had questions about is this hospitalizations part. This does not necessarily mean that the person was hospitalized because of COVID, okay? They're really looking for, okay, were they hospitalized and did they have a positive test? Not necessarily that they were hospitalized because of COVID. So I know that can be sometimes a little bit confusing, but this is really looking for a number of residents who have been hospitalized with a positive COVID-19 test. Okay, so the next thing we're going to look at is going to be the point of care test result reporting. So in this, I can't really show you everything because I don't have a CLIA identification number for this fake facility, but you can really see how this is set up. So if you've entered a lot of things in this before, or if you do the person level data reporting, which we'll get to, you should be able to find your residents right in here. So let's say I'm going to enter in something for myself here. And it says that I'm a staff volunteer contractor. It lists off all my stuff. And then I can add a test result if I had a CLIA identification number. So that is a really nice way to find someone, is just clicking the find button and then clicking on them, and all of their information populates. If you don't have someone in there, let's see if we go back, reset this, then you can enter in their information here. So you can either find someone, or if they're not already populated into your system, you can add them in. Now, the one thing I do want to just make note of here, and this goes across the board for any time that you're entering in a resident or staff member into this system, or a visitor, anything like that, whoever you're entering into this system, you want to make sure that their resident ID or their ID in general is very, very unique to them. So for example, with a resident, you might consider using their medical record number, because it's something that is going to stay with them. So you have a reference point, you know how to go back and find that, but it's also something that's going to be completely unique to them. Things we do not want to use include dates. We don't want to use someone's birth date for their resident ID, because I could have the same birth date as someone else who eventually gets added into the system, whether they're a resident, another resident, or if I'm a staff member and another staff member with the same exact birthday gets added in. You really, really want these to be very, very unique. If you don't do that, you could have some problems later on down the road. So definitely consider making this as incredibly unique as possible. And we recommend things like staff ID numbers, like resident MRN numbers, and things like that. All right, so that is your POC testing report. The next thing we'll go over briefly, because I'm sure you're all pretty familiar with this, is going to be the vaccination data reporting. So there are two different ways. There's several different ways. The two ways that I'm going to show you how to report in here are going to be kind of the more traditional way, which is up on the screen right now. And then I will also show you the person level reporting option. So the first one is going to be this, what I consider the more traditional. This is the first option available to you way back in 2021. So this might be what you're most familiar with. So with this, you do have to break things down by the type of healthcare personnel, but this is just looking for the number of healthcare personnel that were eligible to have worked in this healthcare facility for at least one day during the week of data collection. So this is like the number of staff that worked that week. And then the cumulative number of HCP in question number 1 who are up to date with their COVID-19 vaccines. Now, this is one of the new things that they did add as of April 1st, is this kind of please review the current definition. So if you click on that, that is going to take you here. And if you scroll down, there probably is this kind of decision tree that could be helpful. So if they've received 1 or more, are they 65 years of age or older? If they are, did they receive 2? Then they are up to date. So this is going to be your way to kind of remind yourself of what it means to be up to date. So that's been a new addition, I think, since April 1st. But you run through this, and ultimately what needs to happen is that these questions, all of these down below, need to add up to number 1. So this is your total number of staff, and then these are the individual characteristics of that total number of staff. So just keep that in mind that this does need to be cumulative. So these all add up to this first one. So you're looking at who's up to date, and then basically who's not up to date and the reason why. Now, one thing I will mention though, the one caveat to that is this unknown/other COVID-19 vaccination status. Let's say someone has agreed to get the vaccine, but maybe you're not having your vaccine clinic for another week. They could go under this unknown/other COVID-19 vaccination status because they didn't decline, they don't have a medical contraindication, they just are waiting for your vaccine clinic to happen. So they can end up in this. That would be a prime example of why you would add anyone to this 3.3 option. Now, the other one, oops, I guess I could have left that up. Let's find this current date. The other one is your residence, which looks very similar, except there's less columns. So it's again going to ask you the number of residents staying in this facility for at least 1 day during the week of data collection. Then it's again going to ask you who's up to date. And then again, medical contraindications offered but declined, and then unknown. So very, very similar. It's going to be the exact same thing. This is your total number, and all of these boxes need to add up to your total number up here. So I wanted to show you next the person level forms. I'm a big fan of these. Now, this is not the best option for everyone. I would not necessarily suggest this form for someone who has a huge facility with lots of residents. If that's yours, if that's the case at your facility, it might make more sense to do the traditional way, which I just showed. If you have a smaller facility, this could be an excellent option for you. Now, the benefits of these person level forms is that when those changes went into place, for example, back on April 1st with the up-to-date definition change, this system already had all of the dates of those vaccines. So it knew that, let's see, that this person got the 2023-2024 updated COVID-19 vaccine on 12/12, and then it also would know whether or not that means they're up to date because it can say, okay, it's been more than 4 months since then. So it takes the thinking out of it for you. That's why I'm a big champion of this system. But again, I recognize that this does not work for everyone. What happens with this system is that whenever you get a new healthcare personnel, so for this, since we don't have technical, I need to do this a different way. Since we don't have technical team member identifiers, we do it this way just for this fake system. But let's say we do, we're going to add someone in here. So you will add in all of their information here. You do need to add in the race and ethnicity. You can see the things that are required by these asterisks. And then you need to put in when their start date was and what type of employee they are. And then when they got any sort of vaccines. Now, this system is smart, so I do need to be mindful about what dates I pick. Obviously, when you're putting it in for a real person that you have that real information for, it's going to work a little bit better. So let's say they got that one on that date. And actually, let's just say that she only got the current vaccine. That'll make this a little bit more simple. So let's say that Jana got this 2023-2024 vaccine on March 1st. Yes, March 1st will work perfectly. So if I save her now, she's going to populate down here, and there she is. She's down here at the bottom. And then I just put in that she's only gotten that one vaccine, and she got it on March 1st, which is less than 4 months ago. Now, all you have to do with this form when you want to submit your data for the week is click View Reporting Summary and Submit. You'll recognize this form layout. It looks pretty similar to the one that's the more traditional viewpoint. And all you'll need to do is press Save and Submit Data. Now, if there is something wrong with your data when you're on this page, if there's just something wrong, like maybe you have a date that's incorrect in here and the system recognizes that it's incorrect, when you click this button, it will show you the errors. And then you can go in and fix them. And once you fix them and you press that button again, you should get to this page. And then all you have to do is click Save and Submit Data. Now, the nice thing about this is that once you go back into the more traditional data viewpoint, it's already put in all those numbers there. So they talk to each other. When you press Save and Submit on the person level data, it talks to this form. So it automatically adds that data in. Now you can do the exact same thing with the person level forms with residents. So for this one, instead of adding a new person, I'm just going to put in another date. Let's say that this person, because they were outside of the 4 months, on May 1st, they got another dose of the 2023-2024 updated COVID-19 vaccine because they are over the age of 65. It's not their birthday. Here's their birthday. They're over the age of 65, and they were due for another vaccine because they got the first dose back on 11. Did I do this right? Yes, on 11/17, they got the first dose. So that's how you can kind of tell in there. And once you again press View Reporting Summary and Submit, you can see all of this. It looks similar to that resident traditional viewpoint. And you can see that it looks and finds who is up to date for you. So I don't have to do any of the thinking. It recognized that the only person that was up to date was that person I just added another vaccine for. So again, I can press Save and Submit Data. It tells me that it's successfully saved. And I can go and double check things by clicking on this vaccination residence. And it's going to pop up right there. And it's going to show me all of those numbers are there. The one tricky thing that I do just want to reference with these person level forms is that you cannot delete people out of here. Okay, there's no delete button. That is one tough thing about this form. So let's say I accidentally input someone twice or something like that. What I would have to do is wait until I have someone new to add to overwrite it. So let's say it's not Ariel anymore. We'll just name her Little now. She's the Little Mermaid. I could overwrite it like that, and you can fill out all of this stuff over top of this, but I have no ability to delete this. I can duplicate a row, but for whatever reason, it does not let you delete anyone. So just keep that in mind, to just be mindful if you're switching over to this person level form, that you have to be pretty careful about what you're putting in there because you aren't able to delete things. Now, if you'd ever like to move over to these person level forms, again, that's something our team can help you with. We can look at things with you. We can give you suggestions on the best way for you to move forward. So if you ever are needing help with anything like that, one of the places you can reach out to us at is, and we'll put this on the screen later, is immunizations@superiorhealthqa.org. Again, we'll put that on the screen a little bit later. Okay, so I hope this has given people enough time to open up NHSN if they wanted to follow along with reporting the HCP influenza data. Now, my first question that I want to ask, if people are following along, is do you all have the healthcare personnel safety component? If you want to put in the chat, if anyone says, if you say no, I've just got an extra couple of steps potentially to show you. But if everyone has access to it, then I won't go over that. I'll give everyone a couple seconds to look and see if you have the healthcare personnel safety component.
Not seeing anything in the chat, Melina.
All right, I see one no. Okay, that just came in. So thank you for letting us know that. So the way that you're going to be able to find this, so I'm going to have to take a couple back steps here, because what we need to identify first is we need to identify who our facility administrator is. So when you hover over facility, if you click onto facility info and you scroll down to the bottom, there should be something in this area that says contact information. And you can see the facility administrator, and the facility administrator for this account is myself. You should be able to look for that. Now, my question for you, Lisa, I'm not picking on you, I promise. I just want to make sure I can help you. Because my question is going to be, does that facility administrator list you as the facility administrator or someone else? Now, the facility administrator is not necessarily, okay, perfect, Lisa, that's helpful for me to understand as well. The facility administrator listed here is not necessarily your nursing home administrator. The facility administrator in NHSN is just the person who is identified as the administrator for your NHSN account. I want to make that clear. Now, Lisa, up above, we have this components followed section. Now, if you're also listed as an administrator, you might be able to do this. But we never want to unclick these boxes. I'm going to put that out there first. You never, ever want to unclick these boxes because it will unenroll you, de-enroll you from, disenroll you, whatever it's called, from NHSN. So if I unclick this long-term care facility box, I would no longer have access to this long-term care facility component. What I would like you to try is to try to click off on this healthcare personnel safety component and give me a yes if it lets you do that. It could be, see how this one is grayed out and I wouldn't even be able to click it if I want to. That could be happening to you and I can explain why. And what this is going to do is it's going to activate that component. So there's a lot of components here. Oh, that's okay, Lisa. And you can reach out to me too if you need some extra help with this. More than happy to do that. But this healthcare personnel safety is going to be the component that we need to activate. And what happens is when you activate these components, is that makes it so you have access to report in them. Now, let's say you are not listed as the administrator. That means that you are not the person who has the ability to activate these components. Technically, the only person that's able to activate the component is going to be your facility administrator. Now, if that's the case, you would have to work with your facility administrator to log into NHSN and activate this component so that you can get this reporting done. Now, the one thing that will make this extra difficult for people is that if your facility administrator is no longer with your organization, so you can't get access to them to log in anymore because they don't work there, you are going to have to go through a different process and you will likely miss this deadline. You would have to go, and I'm just going to pull it up right now. Oops, no. Let's see here. You are going to have to go, and you want to do this anyways. We always suggest being proactive, that when someone is leaving your facility, especially if they're listed as this facility administrator, before they leave, we want them to switch the administrator off to a different staff member who is staying so that you can do all of these things and you have access to the things you need access to within NHSN. So if your facility administrator, the person that's listed there, is no longer with your organization and you have no access to them getting into the system or anything like that, you will have to fill out this NHSN facility administrator change request form. And you can see here that it takes up to 5 days for that change request to be verified and completed. Okay. Now, they also tell you the instructions for reassigning. So let's say you are the person who is always in NHSN. The person that's listed as the administrator, they are at your organization, but they maybe don't even remember their password 90% of the time, and they really just want to hand this off to you. They can reassign you as the NHSN facility administrator, okay? So they don't have to keep that role. They could give that to you since you're the person that's more familiar with NHSN. And this page will also explain how to do that. So let's go back into it. Once you get this activated, and even if you want to revisit this after this call, if you're on your phone and you won't be at your computer for a little while, we do have this guide, which looks like this. I'm going to put it in the chat one more time so people have access to it again. This guide is going to walk you through exactly what I'm talking about right now. And it's really going to show you everything that you need to have to put in through here. How many administrators can you have for your facility? Now, typically there's just going to be one primary one, but you can give administrator rights to other people. So let me show you that really quickly. I think I want to go to find actually. So let me go into, I'm pretty sure I did it for Kim. So if I find this user, so she's already put into our system. If I do her edit and then edit rights, take it 1 second, you can see that here I have made Kim the healthcare personnel safety administrator and the long-term care facility administrator. So you can see right here, administrator rights, that's who I gave it to. Now, for me at this fake facility, I want my team members, everyone to have access to everything in NHSN so that they can all play around in our system and things like that. I also think though, Lisa, I think this is a great question, is that if you do have a different administrator listed there, and they don't want to give up administrator right, or they don't want to give up that title of administrator. So like how you saw how at the bottom of my last screen, it just listed me as the administrator. You can see here that Kim, K. Heft, she also has administrator rights, but she's not listed down there. So she should still theoretically be able to go in and activate components because I made her that administrator, gave her those administrator rights. So that's another option. So if your administrator, your NHSN administrator, doesn't want to give up that NHSN administrator title, but they want you to be able to do whatever you need to do in the system, they could go to users, find you, which I'll do this one more time. Find your, you can do it by first name or anything like that. Find you. You get to this page, you edit rights. And this should be, I believe this is also in this guide. In fact, I'm positive that it is in this guide. So if you need to revisit this, it's going to be in that link that I just linked. But that's where they could click off on these boxes to make you an administrator and give you whatever rights you need. If they want to say, I want you to be able to have access to anything that you need access into the system, they can click off on these things to make that happen. Awesome. Perfect. I'm glad that helped, Lisa. So the next thing I'm just going to show you, which this is going to be the easy part. The tough part is making sure that you have access to the component. Once you get access to the component, look at that. I spoke too soon. Once you get access to the component, we get to the easy part. So let me make sure. There we go. Something weird just happened. So once you get access to the component and you go back to this home landing page, you'll select the component, healthcare personnel safety. You'll click submit. And this page is going to look almost exactly the same as the long-term care facility page. You see all these things over on the left-hand side. They look so incredibly similar to what you're used to looking at. And you're still going to go to this vaccination summary area. And then you're only going to have one option, an annual vaccination flu summary. And you're going to click add. It should automatically populate exactly what you need, influenza vaccination summary. So you can click continue. And what you're going to be able to do here is just check and make sure that these things are correct, that it lists your facility name, it lists the correct vaccination type, it lists the influenza subtype, and then you're going to click the season. Now, I've already done this demonstration before, so when I clicked this current season, all of these numbers automatically populated, and you can see that the last time I modified it was on 3/20/24. Okay, so back on 3/20, I put in all of these numbers, and it reminds me that I did that right there. But all you have to do is answer these questions, and you can see again, the questions that are required have this red asterisk by them. So you're going to be looking at the number of healthcare personnel who worked at the healthcare facility at least one day between October 1st and March 31st. The number of healthcare personnel who received an influenza vaccine at this healthcare facility since influenza vaccine became available this season. The number of healthcare personnel who provided a written report or documentation of influenza vaccination outside of the healthcare facility since influenza vaccine became available this season. The number of healthcare personnel who have a medical contraindication, the number of healthcare personnel who declined to receive the vaccine, and then the number of healthcare personnel with unknown vaccination status. Now, again, all of these numbers, 1, 2, 3, 4, 5, must add up to this top number. So you can see question 2, I put 3 people, and question 3, I put 2 people, and that needs to add up to question 1, which is 5, and it does. Once you add in all of that information, it is as simple as, there's probably going to be like a save button down here of some sort, as simple as clicking save, and then you can exit out of that system. And let's say I want to go in, I can find it. And there it is. It will pull it up and it will show me that it was modified and saved on this date. So any questions on that? Okay, not seeing any. I do want to just put the reminder out that if there's anything else that we didn't cover that you were hoping to hear, please feel free to put that in the chat or unmute yourself. You're more than welcome to do that. That was going to be the main parts that we give a tutorial on today. So we have plenty of time now for anyone to ask questions while we wait for anything to come in, and I can always toggle back to the to the NHSN tutorial. But I do just want to mention a couple different things. If, for example, today you just learned about these new up-to-date definitions, and you realize that maybe you need some help with getting another mobile vaccination clinic to come out to your facility and give vaccines to now eligible residents or staff members, feel free to reach out to us. We have partners in all 3 states, Michigan, Minnesota, and Wisconsin, that can provide COVID-19, pneumococcal, and influenza vaccines. I know we're outside of that, but just putting that out there as well in your facility. So they can come in and they will provide those 3 vaccines. There will be no cost to your facility or your individual residents or staff members. Now, if your residents or staff members have insurance, they will bill insurance, but typically this COVID vaccine, for example, they're going to be covered by those insurances. Now, if there are people who are or underinsured, Superior Health takes on the bill for those residents and or staff members so that they don't have the barrier of cost. One thing I will mention is that in some of these states, though, in particular Wisconsin and possibly Minnesota on a case-by-case basis, is that we are partnered with pharmacists. So one of the reasons why you might have identified why it's been a little more difficult to get a mobile vaccination partner out to our facility, it could be because at the end of the public health emergency, pharmacists were no longer able to bill Medicare Part A. So when they come into your facility and they're not able to bill Medicare Part A, they might ask you to bill Medicare Part A and then reimburse them the money that you get back from Medicare Part A. So just putting it out there as well.
We have a question, Elena. I'm sorry. The question is, why do they ask for staff vaccine refusal numbers when vaccine is no longer required? We always report 0. So Dean, if this is in regards to a COVID vaccine, that's a little different than the influenza. In regards to influenza vaccine reporting for staff, it is a direct link to your QRP. It is part of your quality reporting program for your payment methods with CMS. That was rescinded for the COVID vaccines, but it is still part of the collection of data. It is still a data collection tool for CDC and NHSN, but that is not linked on the COVID vaccines relationship to your staff. So you are still required to report it accurately, though, for staff vaccine.
And it should, because there are those because it's going to ask you for things to be cumulative. Yeah. I guess I would be interested in how you get around putting 0 in, unless you're putting 0 in for everything.
Yeah.
Because if you put in 5 here, I have to make sure that everything beneath it, and this goes for both influenza and COVID-19, I have to ensure that all of the numbers beneath add up to that one number. So while there would be no penalty if you have a lot of refusals, there's no penalty for that. They do require that to be added into the system so that they just have kind of that aggregate information.
And it is still part of the F tags. It's part of the regulations that we educate and offer the opportunity to staff to get vaccinated for both COVID and influenza. So those are still both active FTAGs and regulatory requirements. The requirement is not that you have to have the vaccine, it's that you have to offer and educate staff on the vaccine. And have
A
proof
great
that you've done
question
so.
though, Dean, because I'm sure
Yeah.
you are not alone in what you're doing. I'm sure others are doing the same thing.
Mhm. I hope that helped.
And Jana, while we wait for more questions to come in, do you want to talk about your road show?
Yeah, so I'm with the Targeted Response QII team, and we are going to start doing some in-person infection preventionist trainings. Our first is kicking off next week in the Upper Peninsula of Michigan. We will be in Marquette for a one-day infection preventionist seminar. We hope, if there is interest, to take that to the more rural areas of Wisconsin and Minnesota later this summer. So please watch our postings for that as we get those set up. And we also are just in the middle, we're almost finished with our affinity group that we are completing for infection preventionist. It is a 6-week seminar. Those are being recorded, and we're utilizing the FTAGs related to all things infection control, starting with F800 and going forward. So we're covering everything from antibiotic stewardship to F945 education requirements around infection control. So we've had really good attendance and good interactions. So if you've not joined those calls, please find that on the events tab at Superior Health.
Thanks, Jana. And I'm just going to scroll through our last couple of slides here, but again, please feel free to unmute yourself or add any questions you might have in the chat. We'll be happy to answer them.
I did put the evaluation up in chat, so we would encourage you to please participate. We always appreciate your feedback on our presentations.
Yes, please. Thank you.
Elena, this is Kim.
Yeah.
Was there a review on how to make sure that your annual summary was actually submitted, that it went through? What if there's a question on that? If you did it, I'm sorry, I must have missed it.
No, absolutely. So one way that you can definitely make sure that that happened is by hovering over and doing this find option. And you can, this will automatically populate, but then you can search for your flu season and find, and it will show you. So I already submitted and it shows me everything is grayed out, and it shows me that I last modified it then, and I'd be able to edit it. So let's say I put stuff in back in 320, but I had someone else get a vaccine after that, and maybe they were on my payroll. So I'm going to put a 6 there, and I'll update this to 4. Again, I need these to add up to 6, and I can save and press OK. And this will pop up. This is not necessarily required to answer all these questions. Well, actually it is. This is new. So you might have to answer these questions. This was not a requirement back a few months ago when I initially filled this out, but you would have to enter these answers in, and then you can press save and it will update your data. So this must be something new that they've added since March, that these are required questions to answer. But they look like they're mostly going to ask you about who you include in your campaign, if they're required to pay out of pocket. So they're just looking for some more kind of data related to your vaccination program.
Perfect. Thank you for that, because there was another way through the analysis tab that you could check too. And I just wanted to make sure it's there. See how there's workarounds for different things in different ways. So
yes. So if you're used to running reports, you can definitely do it that way as well.
Thank you.
And let me just, sometimes some of those are down. Like I know pretty recently I'm just going to click off on some other things here so that we can continue this. Sometimes those reports are down. I know pretty recently, the analysis piece was down. So that would be your workaround. But like Kim was saying, if you do the analysis part, you always have to generate your data sets first So don't forget that part. If you're ever looking to run reports, you always have to regenerate data sets. Otherwise, it's not going to show you your most recent data. So you have to click generate the data sets before you can go into reports. And it might take a couple minutes here to generate the data set. So that would be my way around it, would be to find the report. So any other questions? All right. Well, not hearing any. If you have any questions that do come up after this call, feel free. You can especially email me, or you can email this immunizations inbox. And I'm more than happy. I know that this is a deadline today. If you reach out to me, I can hop on a call with you and try to get this sorted out so that you can make sure to get your reporting in on time today. And if not, we will see you all back here in July. If you have more questions to ask, if there's new changes in NHSN, we'll make sure to put that information out to you. But please always feel free to come to us for any questions related to NHSN. As long as it's not a technical issue with the actual system, we should be able to help you navigate it. If it is a technical issue with the actual system, we will have you go through that NHSN help desk. So with that, I think we can end the call a couple minutes early. And like I said, feel free to reach out if you have any questions that weren't answered today. So thank you everyone for joining us. Bye-bye.